This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
We're talking about women's health. And this one, I think I know a little bit more about.
Right, you do.
So I feel a little bit more comfortable with this one.
Yes, and thanks for having me this morning.
Yes, we're very happy to have you. Let's start out first, for folks that don't know you, like me, tell me a little bit about yourself.
So I just had a birthday yesterday. I'm turned 38.
Happy birthday.
Thank you.
That's a good year.
I am from a very, very small town in West Virginia called McFarland, which is in Ritchie County, a couple of hours from here. Grew up in West Virginia my whole life. I went to Marshall University for medical school.
All right.
Go Herd.
See, if Dave was here, he'd be all over that.
I had to plug that in there.
Yeah.
And then I practiced in Marietta, Ohio for 5 years after residency. Got remarried, moved to Morgantown, and have been here for a little over 2 years now.
All right. Wonderful. And obviously, you're working with Mon Health.
Yes.
And there's a lot of wonderful things happening there, especially in the world of OBGYN. And we'll talk about what some of those services are here in just a moment. But in general, we're going to be talking about gynecology services. And I guess, you know, it's no secret, I'm pregnant. I'm coming up on 18 weeks here. And it's just amazing, I think, how your body goes through so many changes as a woman, whether it be pregnancy or hormones in general, unrelated to even having babies, or what happens when you get into later phases of life.
Right.
So we have all of these different seasons of life.
Right.
And what's very interesting to me is that OBGYNs, they can really be your go-to person through all of the seasons.
Through your entire life.
Yeah.
Yes.
And I find, I don't know if this is recommended, but I use my OBGYN as my primary caregiver.
For a lot of women, we are their primary care providers. Now, if something comes up that we feel like we aren't the best person to handle and we would need to get you to someone else, we're capable of doing that. But for a lot of women, you know, we are their primary care providers a lot of times.
And that's wonderful, too, because you can build such a great relationship.
Right.
And I think that's a big part of what you do. So let's start talking a little bit about the gynecological services that you offer. So what kinds of issues do you focus on?
So as you alluded to, we can take care of a woman's health really from about teenage years to adolescence through till the day that she dies. We take care of, you know, a teenager starting their first period all through, you know, painful periods, heavy periods, endometriosis, infertility evaluation and treatment, hysterectomies, pelvic floor urinary incontinence problems. Really, there is a full range of full service that we offer at Mon Health.
Mm-hmm. And what age should women actually start coming in and getting annual exams? I was actually just talking to somebody about this the other day. I have a niece. She's still quite young. But what age, when should she start going?
It's a great question. The American College of Obstetrics and Gynecologists, or ACOG, which is our governing body, suggests that the first GYN exam should be in the teenage years, somewhere between the ages of 13 and 15. The purpose of that exam really is just so that the girl becomes familiar with her doctor or her care provider and a relationship can be built and established. Typically not at that exam a pelvic exam is done or anything like that, but we can review, you know, immunization guidelines, see how school is going, treat the whole person, but typically they do not get a pelvic exam at that visit. Pap smears now start at age 21, which is a change from what maybe most people are used to, but that's when they start now.
Okay. So again, it's about building that relationship.
Correct.
And getting people to be comfortable because, you know, I'm sure that there's even people that are listening right now, and as you're using certain words, it kind of makes them feel uncomfortable.
Yes.
It's something that can sometimes be difficult to talk about.
Yes.
So if someone like that is listening, how can you help to encourage them to come to these appointments and to start to put aside some of that discomfort? Do you have any thoughts on that?
Yes. Well, this is what I do for a living. So I have heard it all.
Right.
I assure you,
Right.
it is not the first time that I will be hearing probably what you're coming to talk about. And if you're, very uncomfortable, we can sit and have a discussion with your clothes on, and then you can come back at a later date when you're more comfortable for the exam portion. There is no, one size fits all. We treat each person individually, and I think that's how a lot of patients feel the difference at Mon is like we tend to treat each patient individually.
Mm-hmm.
So if you're not comfortable, come and talk to me. We can talk about your issues, and then if you, want to come back later, we can do an exam later.
So there are different opportunities. It's just a matter of getting in the door and having that conversation and having a frank conversation and saying, I'm not comfortable with this with your
Right.
doctor.
Correct.
All right. And along those lines, and some of this is education, which is one of the reasons we're doing this show, why is it so important for people to get educated about these topics, especially the ones that are, for lack of a better word, a little taboo?
Education is probably the most important thing that we do. So we want our patients to understand the choices that they make every day and how that can impact their lives. And we want them to make the absolute best choices possible for their care. If you feel too uncomfortable to talk about certain things, that may detrimentally affect your health. And so we want you to be comfortable. We want you to talk about things. And then we can educate, bring up guidelines and how things could fit your particular situation.
Sure. Well, we are going to take a quick break now, and then we are going to come back and we're going to switch gears just ever so slightly and talk about the OB services. So we'll focus on that next when we return right here on Mon Health Talk Radio, WAJR. We are back, Mon Health Talk Radio. I am Sarah Giosi. Dave is out today, but in here having a wonderful conversation with me is Dr. Candi McCullough, OBGYN at Mon Health Obstetrics. I always have trouble with that word, and gynecology. But I did all right. I didn't butcher it too bad.
Great.
So we're going to talk now about obstetrics. See, even better the second time. And again, I mentioned I'm coming up on 18 weeks pregnant. So this is one that for me is like near and dear to my heart right now. For people that are out there that are maybe they're working on it, they're in the trying process, or they're family planning, or they just found out they are pregnant. Is Mon Health a place that you can go from beginning of pregnancy all the way through delivery, or is there a certain period of time you should wait before you start to make an appointment? How does that work?
Absolutely. We can see you as soon as you get a positive pregnancy test. Call in and we're happy to take care of you. Even prior to, we can do some preconception counseling visits, especially if you're on medications or something like that. We can help let you know what medicines you should stay on, which medicines you shouldn't stay on. Typically, we try to get new OBs in by their 8-week visit, but some people need to be seen sooner than that. For if people have had problems in the past or anything, just let them know that, and we'll get you in sooner than that. We do see you the entire pregnancy, delivery, postpartum care, and beyond.
And that's so important. We kind of have started societally talking about postpartum a little bit more, but it is such an important piece of the puzzle and such an important piece of the care is to have those follow-up appointments after you've had the baby.
Right.
And to be, again, having this relationship and these open conversations with your OB about how you're feeling and ways that you can cope with feelings. I say it this way. It's going to make me sound like a crazy person, okay? And I'll just admit that. But I always say I wish we were more like kangaroos or something, because you take all this time to develop this baby. And, we say 9 months, but it's more like 10 because it's 40 weeks. You take all this time to develop this baby, and they're with you, and then it's all of the sudden, and even if you have, let's say, 40 hours of labor, it's still all of the sudden that baby's gone. And there is this part that is so beautiful. It is amazing to have that baby in your arms, but it is completely natural to mourn the loss of that pregnancy in that moment too. And it's okay to have both feelings.
Right.
And I don't think we talk about that a lot. And this postpartum piece is just so important. But that's one of those, as we were talking about building a relationship, going all the way back from your first appointment as a 13-year-old perhaps, being able to come up through, you guys are there for the postpartum.
Right. And ACOG especially has focused this year on how can we make postpartum care better. Typically in years past, you have a baby, hey, we'll see you back in 6 weeks.
Right.
Here's this newborn who's completely dependent on you. We'll see how that goes in 6 weeks. Right. Major life changes happen, and we feel like probably that hasn't been a very great care model. And so now we're trying to see them back within a week or two. How are you coping? Do you have any postpartum depression? This is a major life change. How is feeding going? How are you feeding the baby? Do you need help with that? We have lactation consultants, multiple lactation consultants that can help with those areas. And so we're trying to do a better job with that postpartum care.
Yeah. And again, I just think it's so important. What I was saying about the kangaroo part, because I realized I didn't finish and I left it at a weird place. They have the pouch, so then the baby gets to stay with them.
Yes.
We don't have that luxury as human women.
Right.
And again, so checking in these weeks after, your body is going through so much, your brain, your emotions, your hormones. It's all just so important. Now, as we talk about the many providers and physicians that you have at Mon Health, there's a wide array of people to choose from because, again, this is a relationship.
Correct. And sometimes you may form better relationships with one person or another. We have lots of options. And so recently, our practice, which was Mon Health OBGYN, incorporated Women's Healthcare of Morgantown. And so now we have 7 doctors. 4 of those doctors are female. 3 of those doctors are male. We also have 3 female nurse practitioners and a midwife. And so, you're welcome to schedule with whoever you feel like you have a particular bond with.
And talk to me about the quality of the care. We were kind of talking off air about this a little bit too.
Right. I feel like that is something that Mon Health does incredibly well. And I have worked in other places, and I just have the utmost to say about Mon Health. When you come to deliver, it's fabulous. So a recent change in the practice that we have made is that it used to be when a doctor was on call, we had a full office schedule, and then we were also taking care of laboring moms in the hospital and anyone that was admitted to the hospital, whether that be a post-op GYN patient or whatever. Now when we're on call, we are only devoted to the hospital. So we're much more available to patients who are laboring. We can provide labor support a whole lot more than we used to be able to. We're much more readily available. Patient safety has also been in the news a lot this year. It provides a safer environment for the patient. Something I really have to give Mon credit for too is a one-on-one nursing ratio. So if you're in labor, your nurse is your nurse. She doesn't have any other patients in labor. She can focus all of her time on you. And so that, I think, for patients is tremendous. A lot of other places don't have that experience. And so that's wonderful. We do have also in a lot of the rooms birthing tubs that patients can labor in. We don't deliver in the tubs, but they can labor. We have wireless monitors. We have the ability to do intermittent monitoring and things like that. And in my previous practices and places that I used to work, I would have patients come in with birth plans, and kind of almost universally the things that they're asking for, we are doing here at Mon as routine practice.
Delayed cord clamping is one of the big ones that I know people used to ask for. It didn't used to be.
Yes.
And now it's something that I think you do it for every birth, right? Yeah, routinely.
Yes. The caveat to that is that if the baby comes out and needs resuscitated, then we may have to get the baby over quickly to be resuscitated. However, in studies, it's also shown that if you milk the cord and you get that blood back to the baby and clamp and cut it quickly, It's about equivalent as delayed cord clamping. So we do have some options there.
Okay, wonderful. We have to fit in another break. I feel like this is one of the ones I could just talk about forever.
Yes.
But we have to fit in another break. We will be right back with Mon Health Talk Radio on WAJR. We are back. I am Sarah Giosi, and in with me today, we are talking with Dr. Candi McCullough, OBGYN at the Mon Health Obstetrics and Gynecology. And we're going to talk very quickly here for a moment about Zika, because this is something we had heard about. Was that like 2 years ago, maybe? It was all over the news. And especially Florida, things like, saying, oh, be
Right.
careful visiting. And we haven't really heard about it much at all since. So is that something we don't have to worry about anymore?
No, it isn't making national news anymore, but it's still as relevant as ever. And I feel like amongst my patients, they have a false sense of, oh, I don't really have to worry about that anymore. Just this past Friday, I saw a patient in my office who, I lifted her shirt to listen to the baby's heartbeat. And I'm like, oh, you have a rash here on your belly. And she's like, oh, I just got back from Mexico. I think it's a heat rash. So Mexico is one of those places where Zika is endemic, and we absolutely recommend no travel to during pregnancy for Zika risk. So it is still very much an issue, even though it's not in the national news anymore. We still need to be cognizant of avoiding those areas of travel during pregnancy.
So take it into consideration, and again, speak to your physician before you plan
Prior
out
to
those
travel.
trips. Yes. All right, let's switch gears because we only have a couple minutes left, and I really want to talk about what happens after you have the baby. I want to talk about the baby. That's the best part, right? So let's talk about it. One of the things about Mon Health is that you are a, quote, baby-friendly hospital. What does that mean?
That means we have extra certification from the World Health Organization to initiate and support a mother in mostly breastfeeding support. Physicians and the nurses all have extra training that we had to go through. We had to do a lot of things to get this accreditation, so it's a huge honor that we have that. Things in place to support that are early skin-to-skin. So for the first hour, the baby is skin-to-skin with mom. That's when the nurses can help initiate breastfeeding with the baby. We do delayed cord clamping. We do rooming in. And so all of those things are to help support that early initiation and bonding.
Wonderful. I love all of that.
Yes.
It's just so great, and it's so important. And again, it's stuff that we're talking about more now than we ever used to. And besides just bonding, why else are baby-focused centers so important?
It's important for the whole family. You really need that extra support. Here's this new life that is entirely dependent on you, and it's mostly an educational focus. So we do a lot of education with the moms, with the family, and so you're not just turned loose. Oh, here's this baby, and now you can figure out what to do with it.
It's true. And people always make the joke, they don't write the manual on
Right.
how to be a parent. And there's plenty of self-help books out there. But there is no one size fits all. Every baby is different. Every family is different.
Right.
And those first hours together, you're just getting to know this little now human
Yes.
that is now there. And it's sort of surreal. So that's something that you guys can really support. Well, we are getting close to wrapping things up now. I just wanted to add in that, of course, if people are listening to this and they're interested and they want to find out more about how to make an appointment, whether it be for OB or GYN services, how do they get a hold of you? Where do they go?
They can call Mon Health OBGYN, and our staff is more than willing to get them an appointment made.
All right, great. Easy to do. And again, it's all about building that relationship and starting it, as early as you can while you're in the
Right.
planning process or even before and going all the way through. So,
Right.
well, thank you so much. Again, we were speaking with
Thank
Dr.
you.
Candi McCullough, OBGYN at Mon Health Obstetrics and Gynecology. And this was one of our focus shows on Mon Health Talk Radio on WAJR.